Okay, well, let's go ahead and get started just in the lieu of time. Hey, everyone, welcome. My name is Mary Jansen. I'm the Regional Director for Child Care Resource Referral in Northeast Iowa. I know many of you, and it's good to see all of your faces. We miss you all dearly. Definitely getting used to the new normal, right, that we're calling right now. I do just want to take a minute and just give you guys a special thank you for everything that you're doing, including all of our partners out there from DHS as well, and our childcare providers and all of you. We just appreciate everything you're doing during this time. We've seen you really step up and be our true childcare heroes, and that's why we're delivering you those cute little signs that you'll be getting soon to place in your front yard. If not, contact your consultant and we'll get those out soon. Delivering is happening this week, so you'll start seeing some familiar faces in your front yards. But we just thank you for everything you're doing. We appreciate it. I know the families and children do as well. And just remember, reach out for any support or anything you need during this time. So I am now going to turn it over to Miss Brenda Loop.
Hello, I'm glad to see all of your faces as well. You probably appreciate seeing my face because I send you lots and lots of emails. So here I am, not in a tropical destination. I'm in Dike, Iowa in my basement. So hello, and thank you all for joining us. I just wanted to give a very brief announcement that as programs are reopening, you may be at reduced capacity, you may be at reduced number of staff available in your programs. And so if you're hearing from families that are looking for childcare right now, I will be putting our statewide referral number in the chat, and then you can also refer families to our website. We do have programs that are open and have capacity to take on additional children. So if you do not in your program have capacity, send them our way, and we will do our best to make sure that we can get a program that is available to meet their needs. And I believe that was my only homework assignment, Tara. So I will turn it over to you.
Yes, I think that was your homework assignment. Thank you, Brenda. And thanks, Mary, too, for welcoming everyone. I'm Tara Rhoades, Child Care Resource and Referral Supervisor in Dubuque, and then Braber, Butler, Franklin, and Grundy. So some of you I know, some of you I don't, but I am glad you're here. I just want to let you know that we do have DHS on with us. So questions that can come up, I know it was in the initial welcome page, but if you have some, go ahead and put them in the chat. If for some reason we can't get to them because of time, we will follow up with you with that answer as best as we can. So we have our DHS partners from the state, and then we also have our DHS licensing consultants on. So hopefully everyone can hear us okay, and we're doing fine. The thing that I want to remind you about is I was on a call last week with some partners, and we were talking about the children and the staff that will be returning to your centers and how things might look different for them. This pandemic that we're going through is nothing we've been through before, and it is trauma, and it is a traumatic event. So children are coming back from their homes that they've been in for a few months now. Unfortunately, some of those homes may not be safe spaces for them. So we want to just remind you of the good work that you always do in supporting those children and supporting the staff. Staff might be coming back with some fear. And so how are we addressing that? Children, we know that child abuse calls have gone down during the pandemic. And when we look at that, we know safe spaces are childcare and schools, and that's where a lot of those calls come from. And so we're going to ask you to just remember that you're mandatory reporters. Some people might have to go review, what to do, but also looking at is it an abuse situation, or is this just a changed behavior? And how are we working with those children? So it really struck a chord with me when I was on that call, because everything is going to look very different. And so giving these children grace, which I know you all do so very, very well, I just think it's good. For me, it was kind of an aha reminder. So I wanted to just make that message out to you, and know that we're here for you to support you if those hard things are happening and hard conversations are happening, or if you're just not sure. CCR&R is here to help you talk through those things, and to just help you find some solutions. So I wanted to make sure that we made a point of talking about that. I am going to then turn it over to Terry Orr. And Terry is going to talk a little bit about virtual visits, as that is something that we are diving into in this world that we're in right now.
Yeah, thanks, Tara. It is wonderful to see all these great faces above the screen. You don't know how amazing it is after being home in your own little space for so long. It's wonderful to see that. So virtual visits is something that we are rolling out and are excited to offer, because we want to continue the services and continue the support that you need in a very safe and efficient manner. So we know that these virtual visits will be a wonderful way to kind of reach out to you. It's something that we're going to offer now, and it may be something ongoing that we'll be offering as well. There might be further barriers down the road due to weather or emergencies, or time constraints, or just maybe this is a preferred method for you for visiting with us too. We're going to be using Teams for the most part in our region, and it's been working pretty well. I think a few people have tried this. We could jump onto this platform. It's nice because we can send you an invite. Actually, we're using Zoom. I'll take that back. But the Teams that we've used before with different people, it's worked pretty well. We can share documents, and that's nice that we can both see the same thing. So in doing the virtual visits, we will definitely work with you beforehand. We'll make sure you're comfortable with things. We'll test out to make sure that things are working. We'll send you documents ahead of time. We'll make sure that your time is used in a valuable manner too. We're not going to jump on this and then spend too much time for you, because I know sometimes having virtual meetings can be exhausting. So we'll make sure to do that. We'll also uphold all the confidentiality and privacy issues that need to be addressed. We'll definitely review everything after the meeting, send you any follow-up as needed. So it kind of is the same type of thing as an on-site. It's just not done in person, of course. So we're pretty excited about being able to do these. If you are feeling, confident that's something that you want to do and want to try it out with us, let us know. We'll be reaching out to you probably soon too with some of these virtual visits. I know QRS visits have worked really well this way. So yeah, anytime that you're thinking that, hey, I really kind of want to have a little bit more than just a phone call, don't hesitate to contact us. We're all excited, or most of us are excited, or maybe a little bit nervous, but we are excited to continue these services in a new way. Thanks. And I'm not for sure who is next.
I'll go ahead and grab it again, Terry. So next on our agenda is this little thing called the CARES Act that you should have all received information about a week and a half ago. My time is missing, so a week and a half ago. There were emails sent out from the Department of Human Services, as well as a letter that was sent out. And we do have Julie Allison, who is part of the call today. And Julie, can you introduce yourself to our center directors, please?
Sure. Hi, everyone. I'm Julie Allison. I'm the Bureau Chief for Child Care, and I oversee all the policy in the Des Moines, I'm located in Des Moines at the Hoover Building. So obviously right now I'm in my home, just like most folks. So yeah, we released our guidance last week. We've been getting a lot of, I think as of yesterday, we approved 117 rejuvenation grants. So we're super excited about that. We've had numerous people apply for the April and month stipend. And as you know, those checks will be going out in June. And we have had over 500 questions to our Can We Help box that we put out there. We we're encouraging people to continue to look at the question and answer document. So we just updated that May 14th, just so you know. We're trying to do a better job at putting on there when it was updated, so you don't have to reread the whole thing if you've already read it once. But we did just recently update it. And I wanted to personally thank you for the survey responses that everybody provided to us. So we had almost, when we sent out that survey saying what would be helpful, we had about 2,000 responses from folks, which really informed the care plan. I know some people are happy with some pieces of it. Some people are not happy with other pieces of it. We did our best given the different challenges with different providers. But your responses that said, mini grants would be real helpful. 50% of the people said that were closed said mini grants would be helpful. 21% said they'd love a mini grant to help with cleaning supplies. That's the rejuvenation grants that we put out there. So it was really helpful to inform us. It seems like I had one more thing to say about that. I don't know. I'll pipe up when I need to, but happy to be here today and really happy to answer any questions that you have if I can. If I can't, like someone earlier said, we'll get you the answer, but glad to be here. Thank you.
Thank you, Julie. And I think hopefully a lot of you have received contact from your childcare consultant through CCR&R to see if you need any help with that, have any questions, whether it's an email or a phone call. If you have specific questions, if you can put them in the chat box, we can, since we have Julie here, and I really appreciate that. And I appreciate Todd Savage reaching out initially. That's wonderful. And if you think of something as we're going, that's fine. I know we have Heidi HotVet up next, who is going to talk about a bunch of things in regards to health and safety, reopening CDC recommendations. I know there are some new things that came out just like Friday or yesterday. So we're gonna throw it to her next. But if you're thinking and there's anything CARES related, please go ahead and put that in the chat box. Okay, so Heidi, we're gonna go to you for now, and then we can pop back to any questions for DHS when you're done.
Great. I'm going to go ahead and share my screen. Okay. Well, I thought I was going to share my screen here. Just a second. Okay. Everybody seeing my screen now?
Yes, we are, Heidi.
Okay, great. Thank you. So I'll introduce myself real quick. So I'm Heidi Hotvedt, and I'm the coordinator for Healthy Childcare Iowa. I was a local nurse consultant actually in Eastern Iowa for about 10 years in Clinton and Jackson County. So just kind of south of you, you all up in your region. And then started as the Healthy Childcare Iowa coordinator at the Iowa Department of Public Health approximately 4.5 years ago. So I want to just say thank you for allowing me to be on today. And then also I really appreciate all of the work that everyone is doing from the consultant staff at CCR&R, from our childcare nurse consultants locally, from our partners at DHS, and then just the providers themselves, because we know that these have been challenging and kind of uncertain times. This is something so new with the coronavirus, and things change often. I mean, as Tara was just saying, when did that come out? Was that Friday? Or, and it just seems like, daily sometimes things change. And so we just have been trying very hard to stay up to date with the most current information and getting that information out. And the partnership with Child Care Resource and Referral and with DHS with getting that information out has been so critical, so that we know that providers are receiving the information that they need and making sure that children are safe and healthy in care. So I do just appreciate all of you. So I just want to do just kind of a quick overview and maybe some things that you haven't heard before from about COVID-19. And then I have some just a few slides to go through, and then I know already one question submitted to me, so I'll try to, if I don't cover it in the information, I'll take any questions as they come up. So just want to do a quick overview first, though. So probably the biggest thing is that we've all heard the COVID-19 symptoms and what COVID-19 is. But most of the time, we've always heard that, fever of 100.4 or higher, the cough and the shortness of breath. So that was kind of the general guidance that had come out originally from the CDC about what COVID-19 was. But we have found out more information as time has gone on with from other countries as well as our own as we've had more cases. And one thing that we do know is that anyone can have mild to severe symptoms. So we have seen both children and adults with very mild cases or even no symptoms at all. I mean, which is surprising. And we know that it's occurring a lot in the state of Iowa lately as we've done increased testing of different groups, that we have had people without symptoms but actually test positive with COVID-19. So that is something that's been maybe newer information that we weren't quite aware of in the initial. The biggest thing that we also know with some of the not having our mild symptoms or not having any symptoms at all, but one other thing that we have heard about most recently, and there's been some studies that have come out, and the CDC has provided guidance related to that we have not only a positive COVID, but then possibly a co-infection with that. So initially, we were really saying, and this is where I think it's challenging, because there was some guidance that we had sent out, if a child was diagnosed with something other than COVID-19, that we would follow the exclusion criteria for that disease. So they were, diagnosed with bronchitis, and so then they could come back into care once they were on antibiotics for that, and they were fever-free. And that has changed because we're finding co-infection, and so a child maybe is diagnosed with something, and then they do go ahead and maybe aren't having the normal symptoms that we would have expected with COVID-19, and then they're tested and they also have COVID-19. So we are focusing on kind of that, what is the general guidance overall when there is a child who is ill. And then I just go back to both the DHS and the Iowa Department of Public Health guidance that says if a child or staff person is ill, they should not be in care. Regardless, I think we kind of want to get into they just had a mild this, or they have a cough, but we think it's related to allergies. I just think we need to really be clear with our programs, and then really encourage our programs to have good policies in place that we need to have staff and children stay out of care if they are ill. There needs to be a backup plan. Families need to understand that a backup plan is so important, because at any time their child may need to be out of care for possibly even an extended period of time, up to 14 days. And that's a long time for a provider, and for a parent to make alternative protocol if they don't already have something kind of in place. So that's where I would just say, making those arrangements at the last minute is probably not the best practice. We really want to make sure that we have those policies and that practice in place prior to that happening. So I just wanted to share that a little bit about some overview that maybe is some new information. But of course, we do continue to say, cough, shortness of breath, difficulty breathing, fever, those are kind of our baseline things, and then really monitoring those temperatures. And then the other thing I just want to talk about is those high-risk individuals. So if you have programs, especially for reopening, and I'll talk a little bit more about our guidance documents for reopening, but for programs that are reopening or are open right now, and maybe they have a staff person that hasn't been been able to work, or they've been maybe they had some symptoms, or maybe they had a family member who was ill. But we do have high-risk individuals that do work in the childcare industry, and we have children in care that have high-risk situations for potential for COVID. And so we want to follow the IDPH and the CDC guidance about that. People with high risk possibly should not be in group care. Children that have high risk for a potential for a severe disease outbreak with COVID, you know, they're the ones that aren't going to have the mild illness. They might have the severe illness. And so we really want to just recommend to parents that they think first about, is this the best place for their child to go right now in a group setting? And also for staff to really evaluate if continuing to work in childcare is best for them and their own health and safety. So I think that's important to know about that, because we really want to avoid those serious complications with the COVID-19, those serious situations that could both affect children and adults. I want to talk about our reopening guidance documents that are available, and I will show you on. I'm going to go through a few of our guidance documents, and then I'm going to show you on our our website where those are found, so that you have that information. But just recently, the CDC posted reopening guidance, and so did Iowa Department of Public Health, and it was specific to kind of that decision tool of how does a child care program decide to reopen? And there's some really helpful information on that reopening guidance tool. So if you haven't seen that, I would suggest that you take a look at that. And then also in addition to the reopening guidance is for our baseline program, whether you're open right now or you're going to be opening, you need to make sure that you're looking at the Department of Human Services website and looking at their guidance document for programs that remain open or are reopening, because it's important for you to be following the DHS requirements for being open during this time. And then also to make sure that you have your system in place, and it covers things like monitoring for temperatures and the health checks and then limiting access to families and to parents bringing children in, rather than and doing that screening kind of at the door, limiting who's coming into your facility, the cleaning and disinfecting that's required, and some of those other things that are part of that DHS guidance. So I would refer you to that. And then the other reopening guidance, there is some just general reopening guidance that is for business communities, and that's part of the Iowa Department of Public Health guidance documents. And so I would refer you to those also on their website. And then there's some great signage too. So if you look on the Iowa Department of Public Health website, there's some great signage that businesses can use, like kind of at the door, do not enter if you have these symptoms, some of them are CDC signage, some of those are IDPH created documents, but unless you want to create your own, it's great to just go and download what's on the website and post those, because that's really helpful. The next thing I want to talk about is the child care centers and home safety concerns, health and safety concerns document. And that's a document that was Iowa Department of Public Health working with DHS created a guidance document kind of around that whole, what do you do if there's a potential or confirmed positive case, and then kind of what that whole process is. And so that guidance document, it seems like that's a recurring question that we're getting, and I think we're getting that because we are seeing more positive cases across the state. So when there's a confirmed positive or a potential COVID positive result, then there's some steps that you as a program and us as consultants need to make sure that you're aware of. And so that guidance document is on the Healthy Childcare Iowa website, and it is also linked on the DHS website and the CCR&R website. So you have several places to go to find it, but it really helps to kind of walk through just kind of the overview of what needs to happen if you have a confirmed positive case or a potential positive, and then going through that decision of, would you need to close your program for a short-term closure to make sure that you're protecting the health and safety of your staff and your children in care. So that guidance is out there, and I would just refer that, sometimes I think, we have some great guidance documents, but I really think working with a consultant, working with your child care nurse consultant to walk you through the guidance document can be very helpful. And then also you really need to work with your local public health. And the reason I'm saying that is because your local public health does, a lot of times they will have more information. So say you're trying to decide, you just found out a parent calls, or a staff person has come and told a program that they have a positive case, or they live with someone who's positive. And so then now what do I do? And so having that consultant, that nurse consultant, to be able to walk you through it, but they're going to direct you to call local public health, because local public health will have some additional information that may be able to give the more additional guidance as to what to do next, those next steps. It could be that depending on the type of exposure, and that's where it's just so unique. It could be, maybe it was a child in a specific room where only the children in that room were exposed and that staff. So they might give guidance document related to that specific situation. But then it may have been an exposure to the whole center. Maybe it's a staff person who floats or who has been in several rooms, and so there's an exposure to the whole center. So that's where local public health is going to be able to provide that specific guidance and walk you through those next steps. The next thing I want to just talk about, the Centers for Disease Control has a great guidance document for child care programs that remain open. And that's also linked on our website, and I'll show you that in a little bit. But I wanted to cover a few things that are part of that guidance document. So whether the program is open and remaining open currently, or they're considering reopening, I would recommend that you take a look at this guidance document, because as we know with DHS, temperature monitoring is a must for those staff and children coming into care. But how do you go about that is kind of how do we work through that? How do we set that up in our facility? And so the CDC has some general guidelines in terms of how does that occur for temperature monitoring. And, best practice would be if you could stand behind a barrier, either a plexiglass or a window type partition, something that you could be a barrier from the person that you're actually screening. Using a no-touch thermometer would be best practice. But we also know that that isn't maybe realistic in some of our programs. And so working with the child care nurse consultant to kind of work through that guidance document for that health monitoring would be really helpful for programs to kind of see. And for one thing, the nurse consultants, they've been on site, so they know kind of the layout of the facility and might say, well, I could see this would work. I'm not sure that this would work. So they might be able to help walk kind of through that temperature monitoring a little bit. For sure, we want to make sure that the staff person who's doing those health checks and temperature monitoring is safe, and so they should be using the personal protective equipment, such as gloves. They should have a face mask. They would probably have a cloth face covering, because with the surgical masks and with N95 masks, those are really limited to healthcare, the healthcare industry, and so that's challenging for our childcare providers to get those. So for sure, we would want them to have a cloth face covering. And I know those can be ordered online. Also, I know a lot of community groups and community organizations are busy making those cloth face masks. So, reach out to your CCR&R office, reach out to your child care nurse consultant, and just say, I need some cloth face coverings for my staff, for those that are doing the monitoring at the door. And so could you find me some resources to help with that? So I know that there's some resources out there, and each local area looks a little different in terms of that. The next thing I just wanted to kind of talk about is the importance of making sure that you're monitoring for that temperature, and if they have 100.4 or higher, they need to not be in care. So that's probably just my overall on that. But if they're having other symptoms, that they're having, just from a visual inspection, they have flushed cheeks, or they are having some difficulty breathing, or they seem really fussy, or they've got a terrible cough when the child's crying as you're trying to do the temperature monitoring. All of those symptoms, they need to be out of care and not allowed to enter the facility. The next thing I just want to talk about, I've had a lot of questions about cloth face coverings, and there is specific guidance around cloth face coverings on the CDC guidance document, as well as the Iowa Department of Public Health. I would say that cloth face coverings, programs wanting to put that into place may consider kind of working with their staff to start using them. A little bit more challenging for children. So if a child is, under the age of two or under, they should not be wearing a cloth face covering. So we know that right off the bat. But for those, the children that are ages 3 or 4, it's really challenging to keep children from taking the cloth face covering off, from not constantly touching their face. And then the CDC has been really clear about the more you touch your cloth face covering or touch your face, the more risk you put, for spreading COVID-19. So I think if any program is thinking about cloth face coverings, is to really think about some of these things. And I just wanted to share with you, I'm in a cohort group with other states, and we've actually sent some information or some questions to the CDC wanting some clarification on cloth face coverings, and that we haven't really received that yet. So hopefully that will come out in maybe an additional guidance document. But these are some of the things that I would just say to be aware of if you're considering having staff and children wearing cloth face coverings. So some things as to children will need to remove them while they're eating their meals, during snack, and when they're drinking water. So they should be removing those. And then where are you going to store those? Is this something that the child care program would provide for staff and children, or is this something that you're going to ask them to provide? And then how many do you want to have on hand? Because if they do get wet or soiled, they need to be removed and laundered. They should be laundered every day. Is that something that you would be sending them home with children and staff, or would they be laundered on site? Best practice would be that they would be laundered on site, but that's something that you would have to determine for your program, how that would best work. As I said, that children and staff need to avoid touching the mask and adjusting it. And if you've noticed anybody wearing cloth face coverings out in public, you're constantly touching your face. And I do the same thing. For one thing, sometimes they slide down, below your nose, so you're adjusting it there. And so it just seems like there are some challenges with it. So just be aware you're not the only one with that challenge. It's kind of a common across the state, the United States right now. And then also, like I said, if during nap time, they should not be wearing a face covering. And then there has been some concerns about wearing cloth face coverings when they're out, playing or, doing physical activity. There's a risk for that. So, I mean, really thinking about how you could make this work, and if it's feasible. And that's what the CDC does have on their guidance document, is if feasible, that children should wear cloth face maskings, face coverings. So that if feasible is really the how does that feasible for your program, and working through that. Cleaning, sanitizing, and disinfecting, just a real quick thing. There are some great guidance about cleaning and disinfecting, specific for childcare settings. So I would encourage you to look that over. One question we keep having that's recurring has been about outdoor playground equipment. And the CDC does say in the guidance document for childcare programs that remained open for cleaning and disinfecting, that you would be just doing those high touch areas on your playground equipment, and that using your disinfectant spray, which is so challenging right now to get disinfectant sprays and cleaning supplies, that they really say that doing a full clean down of a piece of playground equipment is not really the purpose of the cleaning and disinfecting. It's the high touch areas, it's the handhold, it's the railings, it's the ropes on the swings, it's the things where the children are touching, that they should be cleaning and disinfecting those. For sanitizing, we do follow sanitizing for mouth toys and for food, you know, like utensils and dishes that are, because sanitizing is a requirement for those surfaces. So best practice would be using a commercial dishwasher. For those mouth toys is limiting the amount of mouth toys available or rotating them through if you can do that, but definitely having a yuck bucket in the classroom so that when a toy is mouthed, it can be put in there and it can be hopefully run through the dishwasher. That's really best if that can happen. If not, you know, using your sanitizing, whatever you're using, if it's a bleach water soak or if it's a sanitizing agent. So you want to make sure that you're following that. And then the isolation for a child who becomes ill, this is also part of this guidance document from the CDC. And that's really just going to be looking at your program and where would you isolate a child if they became ill during care. And that happens, you know, a child was, you know, no temperature when they arrived at care, they did real great. And by the afternoon, all of a sudden now they're ill. And so we want to make sure that that child is isolated to an area so they're away from other children, that a staff person is there to supervise. The staff person should have a cloth face covering on. They should put gloves on if they're caring for that child and while they're waiting for the parent to come and get them. Making sure parents are aware that they need to come up and pick the child up immediately. If they're ill, they should not be waiting till the end of the day or anything like that. And then if appropriate, and if you have them available, to have the child who's ill, if they're over the age of 2, put on a face covering so that would add another layer of protection.
Heidi, we have a question in the chat
Sure.
that's somewhat related to the child that becomes ill, wondering how long the children should be excluded from care once they have shown that higher temperature of 100.4.
Yeah, so there's some guidance documents around that for exclusion criteria, and we actually have it on our linked onto our Healthy Childcare Iowa website, but it's a CDC guidance related to persons that are ill, and then what is the exclusion criteria. And so right now the exclusion criteria, and like I said, I say it right now because this could change. So just be aware. We did have kind of a change from a 7-day to a 10-day. So I'm, you know, this is as of today. So we have a handout. It's called what, for those that are, I can't remember the name of it. I think it's those that are sick, or what to do if you're sick, I think is what it is. But I'll just read it to you. So children and staff should be excluded from care if they have a fever of 100.4 or higher, no matter what the cause of the fever. That the CDC recommends that the exclusion would be that you need to be 72 hours fever-free without the use of any reducing medication or medications to reduce fever. And so this is an and, so it's not just 72 hours of a fever. I know we've had that question over and over, but it's and they cannot have any other symptoms of illness, and it needs to be 10 days since the beginning of their symptoms. So, and possibly up to, and we know exclusion can be up to 14 days because we know the illness runs communicable disease, the communicable ability part of the disease is 2 to 14 days in terms of its potential for the exposure. So that's kind of the CDC guidance right now is the 72 hours fever-free without the use of any medications. The and, which is the and no other symptoms, and it's been 10 days since the beginning of the symptoms. So, and that's on that guidance document. It's several places in the CDC. It's in the Centers for Disease Control Child Care Programs that remain open. It's also on the if you're ill guidance document. So I hope that helps. I know that that's problematic for a lot of families and for a lot of providers because it's a long time to have a child out, but we need to make sure, or staff, but we need to make sure that that's why we need to have plans in place ahead of time, because during this time, that's what we're going to need to follow unless that changes. I've just got a couple more slides and then I can answer any questions. So I did have some questions about this severe illness in children. And there's a new syndrome that's been identified. And we've actually had, as of yesterday, and I didn't hear the governor's press conference today. I was on a different call, but as of yesterday, we did have 2 children that are being monitored for this syndrome. And it's called multi-system inflammatory syndrome in children, MISC. And it's an associated condition that's with COVID-19 positive children. And it's really in children. They've seen it in children or under the age of 21. So really not occurring in adults at this time. They haven't seen that. It's a very rare condition. They're really not sure about risk factors and kind of the clinical course. They're just trying to work through that right now because it's fairly new. Nationwide, we have more cases that have occurred out east, but like I said, we have 2 children in the state of Iowa that are being monitored. That has been added. There was a health alert that went out from the CDC, and then Iowa Department of Public Health now has that's a reportable, so they are monitoring that, and I know that's being done through our communicable disease division at the Iowa Department of Public Health. And so, you know, in terms of what a child care program needs to know about this condition is, for one thing, it's very rare. And then really at this time, there's no additional information for providers or for parents in terms of the guidance, and it's remaining the same. So it's really those children with high fevers, and they get an inflammatory syndrome that is occurring in kind of the cardiac function, in their vessels, and in organs. So it's really a multi-system organ involvement. So you wouldn't necessarily see it, you know, in terms of the child. I have heard some about rash. So just so you know, that in some of the initial literature that has been a kind of symptom, but we really want to look for those fevers. So excluding if a fever is 100.4 or higher, and then you know, following those specific guidance documents in terms of you know, being excluded from care if they've been ill for that period of time with the CDC, or as if they need to be, if they were exposed, that they need to be out of care for 14 days. And I'm just going to show you real quick where our resources kind of are. So this is our Healthy Childcare Iowa, kind of a screenshot of our Healthy Childcare Iowa website. And it's in the printed products section. So in that tab here, so when you click on that, if you scroll down to the COVID-19 resources section, we have a section that's where we've linked the reopening guidance documents specific for childcare, and then the IDPH kind of general reopening guidance is on there. We've linked the health and safety concerns. This is where that concerns document is here. And then there's some additional information about what the CDC recommends for cleaning and disinfecting. If you've had someone in your facility that was sick with COVID-19, they have some general guidelines about that. The importance of ventilating the room, not going into the room for 24 hours if feasible before you start doing cleaning and disinfecting. So there's some real specific guidelines. And your child care nurse consultant can help you with that if you have that situation occur. And then under the COVID-19 resources, we have a lot of links to the CCR&R website, to the DHS website, to some additional information from Iowa Department of Public Health, just about signage and some general business things. So we've got those links in there. And that's something that we're just keeping up to date as things change. I'm updating it every week, because it seems like every week we have something that changes. So that seems like my norm is, it seems like, I don't know, lately it's been Fridays. I don't know why. I think it'd be easier if it was Monday, but sometimes that Friday afternoon, it seems like I'm in there trying to make changes. So just so you know that is available to you, but reach out to your CCR&R or to your child care nurse consultant or to your DHS consultant so that they can kind of help you find the resources that you need. And I'll take additional questions. It's hard to see the chat box from my screen right now, but is there any other specific questions? I know I had received one from Tara. I just want to double check that I covered it. The question was, should we be requiring masks for employees? So that, like I said, is not a requirement, it's a recommendation. So it's really what's going to work and what is feasible for your program. And then I think it was just said it would be hard for younger children. And yes, if they're under 2 years of age or younger, they should not be wearing, that is a guidance from the CDC and IDPH. They should not be wearing cloth face coverings. And for children that are older than that, I think it's going to be if feasible, if this works in your program. And I do know there are some programs in the state that are having children wear cloth face coverings. The other question was, if a child or employee has a temp or respiratory illness, when would be the right time to require testing? So that's really up to, and I did actually on our resource page, we linked to the Test Iowa site. So I would really recommend that you encourage staff or parents to go to that Test Iowa site so they can fill out that questionnaire and then possibly be directed to go to a testing site. But I will also say that if, every situation is very unique, and reaching out to your primary healthcare provider is really key also, because if a person maybe, and I actually know of 2 cases where this has occurred, where they filled out the information on the Test Iowa site, but didn't maybe include that they had a pre-existing health concern. And then when they talked with their primary care provider, the primary care provider said, oh no, because you have this, we would want to make sure you're tested to make sure that you're not positive for COVID-19 because of the risk for severe illness. So that's why I say kind of both. The Test Iowa site, fill that out, but also contact your or encourage parents or staff to contact their primary care provider if they have questions about testing. And then let's see. We have our high risk or at risk employees, I think is how I'm reading this, that have been off since the beginning of this. Some would like to return. When is the right time? I would refer the staff to their primary, to their care provider, either their specialist or their primary, and ask that question, because that's really going to be based on what is the recommendation from both the CDC and also for that individual person's situation. So hope that answers that. And then there was a question about, should we require families or employees to sign a waiver releasing us from someone contracting COVID-19 from our site? And that's really, and maybe Julie could jump in on this, but that's really something legally, I think, that you would want to talk with your legal advice on that.
Yeah. Yeah, I definitely concur with that. That's a business decision and a legal discussion.
That was the only questions that I had ahead of time. Did anything else jump up in the chat?
There's one, Heidi, but I think it's more for DHS partners, not for you.
Okay, great.
So if anyone else has questions for Heidi, go ahead and put them in the chat. And then Julie, can you see that question? I know sometimes the governor's press conference has remarks that you're not briefed on ahead of time either. And I did watch the recording. Director Garcia did mention about childcare staff having testing. So can you tell us any more about that?
Yeah, I can't. What I can tell you is that we're anticipating some guidance that, and I think Director Garcia referred to that in her in the press release today, that there will be some guidance coming out. We've worked with Heidi and IDPH in regards to some guidance. In that, I would assume then will be some information regarding testing, but I don't know any more than what was shared on the governor's conference.
Thanks, Julie. Heidi, a participant is asking if they have a temperature of 100.4 and then find out it's an ear infection. Do they still need to be gone the 72 hours?
Heidi, did we lose you or are you muted? I don't know if you saw that that's a question for you. Well, it looks like we might have lost Heidi.
I see another one of our nurse consultants. Darla, do you know the answer to that? If it turns out to not be COVID, do they still need to remain out the 72 hours?
Yes, they do, but it's actually also, remember, the 10 days from the start of symptoms, and their symptoms that have to be been improved. So it's those three things, because we know they can have that co-health condition. So they could have ear infection and COVID. So even if they've been diagnosed with ear infection or bronchitis or something, they also need to be out.
Great, thanks for that clarification, Darla. And then Carly is asking if they have a case at a center, should they tell families, and then do they have to close?
Sorry, I lost my internet connection for a minute. This is Heidi back on, so.
That's okay.
But I'm back on, so that's good. What was the question again? I just caught the tail end of it.
If they have a case that at a child care center, should they tell all the enrolled families, and then does the center have to close?
So we would recommend that they inform the family that there's a potential exposure, and that they would provide that guidance document that's on the Healthy Child Care website or the IDPH website. It links to the CDC information about COVID-19. So at least and that just gives an overview of kind of the symptoms. And so then families would have that information, or staff would have that information. It also includes, it to call 911 if they were having severe illness and things like that. So that's just a basic, and it's actually I put it on our Healthy Child Care Iowa section in the exposure section of our COVID-19 resources. And I put in parentheses, this is what you could share with families and with staff. So it just to kind of, if you want to say posting. Right now, Iowa Department of Public Health does not have a posting like what we would normally share with. So I think that's something that, because it's constantly changing with CDC, they haven't really, they don't have like just a clear cut posting for that. So that's the form that we're using to alert families. And then in terms of, when and knowing what to do in terms of closure. Childcare programs may be directed by local public health to close. I mean, if they could actually be, a public health order could be issued. The public health can do that with a business if there is a potential for communicable disease spread. So not just with COVID, but with other things. But in general, I would say that that looking at that guidance document that we have, that health and safety concerns document that says, you may consider a short-term closure for 2 to 5 days, that's going to allow public health time to find out some more information. And what really that's going to allow for is additional cases that might pop up from that exposure. And then they might direct the child care program to close for an extended period of time.
Okay, and then Becky Frost is saying if a staff member has symptoms but has not been tested, what actions should they take other than the staff member leaving? Do the children in her classroom need to go home for isolation?
That's where I would really refer to talking with your local nurse consultant and then your local public health, because in terms of that guidance in terms of that, what the next steps are when that happens. So if they're having, symptoms of COVID and they go home, then there's some guidance that you're going to want to make sure that you're not having potential other, exposures that had occurred in that room. So, or in the whole center. So, I mean, it just depends. It's very unique. So that's where I would just refer back to that guidance document and then talking with your local nurse consultant and your local public health.
Okay, and then Angela's question, what I understood Darla saying is that it doesn't matter what the reason is why the child has a fever, that you still need to have a presumptive positive that they've been exposed. So I guess we're just confirming that if it was an ear infection, it's the 72 hours plus no symptoms for 10 days.
So really, like I said, that co-infection is such a concern. And we just want to go back to that basic from the very beginning. IDPH and DHS both saying if the child or staff is ill, they should not be in care, really, no matter what the cause. So.
Okay, we do not have any other sessions scheduled in our Zoom account right after this. So if we go over 2 o'clock, it's not going to kick us off. So you have a captive audience. If you have other things you'd like to discuss or have additional questions, feel free to throw those out. We still have our DHS partners as well as Heidi and some local nurse consultants and local DHS staff on the call with us.
Brenda, it looks like Becky Frost is saying that her local nurse consultant is the one asking the question about the staff member. So should they be referred to you then, Heidi? The one about if the staff member has symptoms and has not been tested, what do the children in the classroom do? It sounds like Becky Frost is her local nurse consultant is the one asking the question also.
Yeah, and that's where we really work with local public health because, and I don't know, it's hard to explain this, but local public health is going to know if there's an outbreak occurring in your community. So they might have different guidance. So, I mean, definitely, you know, that initial, when that occurs, that's why reaching out, and the local nurse consultant will, sometimes the local nurse consultant actually is the local public health agency, but the local public health agency has guidance specific to that communicable, disease concern. And so that's why I say that, referring to them, and that's what if you contact me, I will contact local public health and talk with them so we can walk through that guidance and decide what to do. I always say err on the side of caution. Doing a short-term, and this is not a requirement, this is a recommendation, but a 2 to 5 day closure, short-term closure. And if you find out that you have a staff person who's going home ill with COVID-19 symptoms and they've been caring for, they were maybe even doing the monitoring at the front door, closing, I would rather say err on the side of caution and decide that you're going to close and do a short-term closure so you can find out more information. That's the whole point, and that's what CDC says. A short-term closure allows time for local public health to determine if there is additional concerns going on in the community. And that's kind of around the bout. I wish it was more just, oh, yes, for sure, this is exactly what you should do, but every situation is very unique.
Heidi, this is Becky. The local nurse consultant, the child care consultant, is from the Department of Health, and they called me today asking me what they should do if a staff member hasn't tested positive. They did have a staff member test positive yesterday.
Okay.
And then they had the second staff member who had symptoms but hasn't been tested, and they wanted to know. They were sending the kids home in the room for the staff member who tested positive, but they weren't sure what to do with the kids in the classroom for the one who had symptoms but had not been tested. And I said, we follow the Department of Health. So
yeah. Okay. Well,
and she is a Department of Health.
Yeah. Yeah. Well, we can, I don't want to get too specific on cases or areas, so you can definitely share that information with me and we can walk through that after this call. But I emailed
you as well.
Okay, I can take a look at that. I'm sorry, this is my second one in a row here of meetings, so I haven't even looked at emails since earlier today. So, but like I said, best practice is always to err on the side. I always say err on the side of caution. If that occurs, if that staff person if you have one positive and you've got another one. And if you haven't talked with the right person at local public health, then do a short-term closure. Gives us time to figure out what's going on. So.
Okay, Heidi, it looks like just wanted some clarification. If a child or staff member has a fever of 100.4 or higher, they need to stay out for 10 days. It's the 10 days is related.
So it's the 72 hours fever-free without fever-reducing medication, and the symptoms have resolved, and it's been 10 days since the symptoms first occurred. So if that's their only symptom, that would be they would be doing that 10 days.
Okay, and I don't know if that we'll have the answer to this question, but on Test Iowa, what work category should they choose if they're working in childcare? Should they use education?
Oh, I'm not sure about that. I can check on that one.
There was one more question there about masks. Can masks be interchanged if washed, or should they stay for each child?
You know, in terms of if you're going to launder them on site, is that what you're asking?
Yeah, I think that's what they mean.
Yeah. I will double check on that, but my understanding is if they're laundered on site, they don't need to be labeling them for each individual child. But I can double check on that one also. That I need to go back to our list that we sent to CDC, because there were some things that were just not clear on some of that guidance. So
could I add something there?
sure. Yep, go ahead.
This is Angie. I'm from the YMCA in Waterloo, and we've been using masks for probably maybe a month now or 3 weeks.
Okay.
And the feedback I would give on that question is that the masks are an obvious, and it depends on if you have a variety of people who made them for you, but all the masks are a little bit different styles, a little bit different fit. And so we worked to find the ones that fit different kids, and we had at first adult and then kid sizes, and then eventually we had to make slightly smaller sizes for the preschool, but then some of the early elementary kids. And so it has worked easiest for us to really, each child has 2 masks, and we Sharpied their names onto those. And then they each have a pencil box that has their name on it. And so when they're laundered at night, the boxes are disinfected with bleach water and left to dry. And then we drop the masks after they come out of the washer into the pencil boxes, and left to air dry overnight with the pencil box open. The next morning, the staff get here and close the boxes and put them at the front for when the kids start arriving. And so we change out the mask at noon after lunch, and they get a new one at that point. But so anyway, my comment back to you is just that the sizing might be a reason. And then I think kids just picked out their own, and then, so.
And were those ones that you provide, those are great, really great, helpful hints. Thank you so much. And it sounds like you have a great system in place. Is that something that you had the parents provide, or was that something that you received through like your community resources?
Yeah, we had several community volunteers who made masks for us. And so we provided them for all the kids and staff.
Okay, great. Thank you so much.
Mm-hmm.
Okay, I did not see any additional questions come up. So in order to be respectful of everyone's time, I think we'll go ahead and end the session. I did post in there, it is being recorded, so we will get that up on the website. I don't know how long that takes. I don't do that. Our wonderful magic fingers, Bobby, at the state level does that for us, but I wouldn't think it'd be more than a day or two that this recording will be available tonight or from today. Any last comments, Tara?
No, just thank you to everyone. Keep doing your good work, and as questions come up and things change, please send them to your childcare consultants, and we will do our very best to get you the answers. Thank you to our partners at DHS and our childcare nurse consultants. We know that we cannot do this. We are kind of like that 3-tiered stool right now where we all need to work together, and we really appreciate you as partners and helping our childcare providers. So thank you so much.
Thanks, everyone.
Thank you.